Crimean-Congo fever. Clickpersky. Congo virus was found in most African countries and South America, but has reached in other countries. Congo virus is spread by flies or grow the tick wild animals. It is way more sheep, goat, cow, buffalo or other animals to move rapidly to another. It also goes a contagious disease. The animal becomes infected by touching or touching tick virus is transmitted to humans, or even pass the virus to the use of the materials used. Tick virus if it moves to cut animals. Care of Congo and human bite marks, but also to the virus. Symptoms. After 5-6 days after the virus enters the body begins to show signs of flu, such as light or fever, symptoms of pain, headache, vomiting, nausea, body weakness last 5 to 7 days. Hunger ends. Is vomiting, nausea becomes severe weakness continues to be patient and go small rash on the whole body, come out blisters in the mouth, like gum bleeding. After 2 days seem to lower blood clot, nose even goes up blood, has a severe lack of platelets the patient's body, causing the condition worsens, the higher hemorrhagic into the patient's body so death the risk will increase. Precautions. Congo necessary precautions to stay safe from viruses. Those livestock rearing cattle on the farm or to take care of the cleaning, wash their bodies. The use of animal medicines and tick spray, so any animal's body or not fly. Cover the body mask and gloves on hand for more precaution in the face of the beast and go through all the clothes from the smoke masks and gloves. Wash hands frequently, spray the daily wash and body spray repeat.